So Amelia, that's our moment to press record. And this, along with all of our other events, is up on our YouTube channel. There are tons of previous events. So if you like that kind of thing, please do head on over there. If you've not been to a HALN event before, then welcome. It's really lovely to have you here. And we've been running now for 6 years almost, and we run a lot of webinars like this where we focus on different thematic topics each time. We run learning sets, of which some of you I can see have been involved in before. So those are kind of smaller communities of practice with peers working across anchor organizations across the UK. We run kind of lunch and learn sessions. So there are opportunities for more kind of peer connections, and we write case studies and blogs. So we're kind of really curious about what it is to be at the intersection of learning, policy, and practice around all things anchors and community wealth building. And there's a lot of you in here, and I know part of the appeal and attraction of days like today is that you get to know a few new people. So I want to invite you just to head over to the chat and say hello. Maybe let us know your name and where you're dialing in from, or your role if you'd like to. It's always great to have a sense of who's in the room, who's joining, and from where, and what perspectives you're all bringing into the session. So just head over to the chat and say hi. And while you do that, I'm going to talk you through our high level session plan for the session. Amelia, do we have a slide for this, or shall I? Yes, we do, I think. Just hold on a moment while we bring that up. No, we don't. I'm going to talk it out loud. So we are in a moment going to introduce a couple of questions on Mentimeter. I'm going to invite you to share a little bit more about your role, where your anchor work is focused, where you're seeing your anchor work have an impact, and a couple of other questions. So I'm hoping that we'll develop a real sense of who's in the room and what you're working on. I'm going to share a couple of minutes, not much more, on reflections of how HALN has evolved over the last 5 or 6 years, some of the changes that we've seen in the anchor landscape, and how the kind of ecosystem of community wealth building and anchor work has evolved across the UK, across all 4 nations in the UK. I am then going to hand over to Michael Wood, who has done a huge amount of work with us over the last few years and always brings such an interesting perspective from his role at the NHS Confederation. So I'm really looking forward to hearing from Michael. Michael's going to speak a little bit more to the broader policy landscape. So what are the implications of some of the recent policy changes? What is he noticing, hearing, and listening to in his role? And then we are going to move into, that will take us till about 1:30. We really wanted this to be a combination of kind of looking at the landscape, hearing from you, and giving you some time in smaller groups to connect and reflect. So about 1:30, we're going to move into some smaller breakout groups for you to have a chance to meet a few new people, share a little bit more about what you're working on, and hear from others. There is no pressure to do that. If you're like, oh, I was just hoping to sit here and listen to people, you can drop off at that point. That's absolutely fine. But we know that for a lot of you, the networking and the value of meeting people working on this in different areas is huge. So I'm expecting that lots of you may well be keen on that. And then we'll come back together after kind of 15 minutes or so of discussion in those smaller groups and just do a bit of plenary playback. So we'll hear a few reflections from those of you in here. I think that'll take us through till 2 p.m. We'll make sure we wrap up on the dot. And there's loads of you saying hello in the chat. It's really wonderful to see where you're dialing in from and all of the work you're doing. If you're just joining us, I can see lots of you just coming in from the waiting room. Welcome. I'm Julia. I am part of the HALN team. I'm helping to host us today, chair us through the session, and head on over to the chat and say hi, introduce yourself. Some fantastic introductions going on there from all across the UK. That, I think, is housekeeping done. I'm going to move us into Mentimeter. So I'm going to preface this by saying we have tested it, but we are also using the free version of Mentimeter, which makes me nervous. So if for any reason this doesn't work for you, I'm going to invite you just to use the chat as a backup, but I'm optimistic. So if you can grab your smartphone or so you can either scan that QR code on there, and I'm going to do this with you so I can kind of sit alongside, Or you can open up a new web browser and go to www.menti.com and then enter the code that's on that screen, 1272 1632. And I am just going to put this into the meeting group chat as well, in case once we move on, people need to access it. Code 1272 1632. When you're in there, if you can just click the thumbs up button to let us know that you're in there, that'll give us a bit of a gauge. Oh, there's lots of exploding thumbs up. Awesome. In Mentimeter, I can see lots of you in there. Great. I'm going to wait till I see the numbers trickle up a little bit more. Those of you just joining, welcome. Oh, thank you, Amelia. You beat me to it. If you've just joined, please hop on to your phone or open up a new browser and head into the Menti there. You can either scan the QR code or enter the code, which Amelia and I have just posted into the chat. And we're on about 35, 36 now. Awesome. Okay, those of you who are still connecting to it, I'm going to invite us to maybe Ollie for us to move on to the first question. But once we're off the screen, you can still use that link to get in. First question is just a bit of who's in the room. So you've got five options there: NHS, local gov, VCSE sector, civil society or government, sorry, civil service or government or other. And select, oh, okay, lots of NHS, some local gov. We're going to give you a minute or so just to fill this in. We've had almost everyone fill it in. So very, very heavily weighted towards the NHS. If you're in the other camp, feel free to let us know in the chat what that other represents. But yeah, noticing there a large proportion of you are dialing in from the kind of NHS perspective. Let's move on, Ollie. Oh, we got four others. Great. Welcome. Welcome, everybody. But also welcome those of you from the NHS. Lots of you in here. Which team are you sitting within? We're really curious about how people, which teams people are based in with anchors. So I am curious to hear, and this is done as a word cloud so that it will reflect the kind of weighting of responses. We've got a lot of public health, workforce, quite a lot of people working in kind of employment and workforce, which would definitely reflect what we're seeing in our learning sets. I'm seeing about half of you have answered this, so I'm gonna hold on. This strategy is kind of coming up from behind. Workforce and people definitely really, really strongly represented here. Quite a few people working on partnerships. There's a few around the edges that I can see in corporate policy, strategy and partnerships, research, transformation, procurement, interesting, economy and inequality, health improvement. And those of you just joining, welcome. You can log into the Mentimeter. Amelia, if you could just copy and paste the sign in again, people who've just joined will be able to log in. So it looks like we've got really, really strong representation from public health, workforce, strategy, partnerships, and to some extent kind of training and population health with smaller representation from a few other areas, which is fascinating. So big public health voice here today. Welcome. Let's head over to the next slide. Next question, which we're curious to explore, is where is your anchor organization focused? Well, bad phrasing, Julia. Where is your organization's anchor work focused? So this one is a sliding scale. So when you look at the Mentimeter, five is the highest priority and one is not a priority. And it invites you to scale up or down your response against each of those five. So feel free to take a minute just to figure out how that one reflects on your screen. If you're on your phone, you just need to go down and scroll down a little bit. So five is it's a big priority. One is it's not really a priority. And just a reminder, if you are on the call but you can't get into the Menti, feel free to add reflections into the chat. Like, what are you focused on? What are you working on? This is interesting. We've got, so yeah, not surprising perhaps given who's on the call, but a lot of focus on employment and recruitment, and also a lot of focus on place-based partnerships and local networks. Also, a decent focus on local procurement and social value, but slightly less on net zero and estates through that anchor lens, which is really interesting. I'll just give it a moment. There's some of you still navigating your way through that question. So I'll wait till I can see a couple more of you adding into it before we move on. And of course, if you've got other priorities which aren't mentioned in there, it would be really interesting to hear about those in the chat. Place-based partnerships, just edging up a little bit there. Interesting. Okay. So, yeah, all of them over 2.5, but definitely employment, recruitment, place-based partnerships edging up towards the top. Let's go to the next one, Ollie. Thank you. So this is a question about impact, and I promise you there's only a couple more after this, but this for us is really interesting to get a picture of who's in the room. So where have you seen your anchor work have the most impact so far? And this is open text, so you can just type in a couple of reflections. Where have you seen your anchor work have the most impact? And thank you, those of you, Debbie and Les, adding into the chat. If you're not in the Mentimeter, you can definitely add this into the chat. But where have you seen your anchor work have the most impact? Seeing some within the workforce at the system level, engaging employers or employability and community outreach, lots on employability and employment again, really interesting. Improving relationships with local educational establishments and job centres. Interesting. Workforce. It's all about the workforce and employment. It's such a strong theme coming through. Lots on networking, collaboration, partnerships. Yeah, allied health professionals, workforce, and service users. Yeah, working kind of across the system, coordinating leadership, bringing colleagues across health boards together and sparking discussions. EDI, equality, diversity, and inclusion, or equity, diversity, inclusion, partnerships. So there's these two, yeah, two very strong themes today on employability and partnerships, which is fascinating for me because that's quite a evolution from where we were 5 years ago when we started HALN, which is great to see. Some of you doing some work within a social prescribing context, and some of you working more on inequality and health. Great. Just going to give it another couple of seconds. If you're typing, feel free to kind of bullet point the response in and just send a brief couple of words. Interesting. Yeah. Supported recruitment, social enterprise cafes in hospitals. I'm so interested in the kind of food provision and supply chains into health systems that I'd love to hear more about that. We don't hear much about it in Hound generally. And then, yeah, partnerships, widening participation. Interesting. Okay. We are going to move on to the next question. So if you didn't quite manage to add it into that one, please do pop it into the chat. And the next one is, what factors are shaping the direction of your anchor work right now? So, for example, like really, this is like, what are the drivers pushing your anchor work? Is it national policy? Is it local priorities? Is it the community priorities that you're hearing about in the engagement work you're doing? Are there other external pressures? So what is kind of driving and shaping the direction of your anchor work? Interesting. Yeah, keep Britain working, review some of the partnerships, leadership, some of the community engagement work, national policy intersecting with local need, national health and local priorities. Yeah, tackling child poverty. Great, interesting. So for many of you, it's a combination of national policy and local health priorities. Some of you getting more from the community engagement and community self-determination. Yeah, some of you having also some operational factors affecting you, finance challenges, internal team priority, political leadership, social mobility, economic inactivity, preventative approaches to population health challenges. Interesting. Okay. Give you another kind of 10 seconds or so on that. A lot around work, growth, and health. And Michael, I know we're bringing you in to share your reflections later, but if you've got anything bubbling up for you and you want to come in and share a reflection as we go through these final couple of slides, please do. There's a lot of interesting, it's kind of giving us a real sense of what people in the room are focused on. Prevention, partnerships.
There's an interesting mix, Julie, of the tangible and the intangible. And I think that's what is unique about this agenda, because the intangible, we may not be able to measure it, but that's the glue that teaches us how to be a good partner, which actually delivers impact. And I think that's often where the joy is found too, especially in quite difficult, times of transition. So, but the answers to this question are particularly interesting, I think, to reflect on afterwards, actually, because and how do we take this and help support it for the next 5 years, which I know we'll look at today too.
Mm, lovely. Thank you. All right, Ollie, let's move on to what is, I think, our final question. And this is one which for us is very pertinent because we're 5 years into the HALN network, and many of you have been with us since the start. Some of you may be at your first event today. But when you think about what you need to take anchor work forward in your local contexts and organizations, how can we help or add value? Like, is it case studies or research or convening or yeah, like the networking opportunities. Very curious to hear what you would find helpful. So, for example, in some of the learning sets that we've been running, we have been sharing slides with case studies and examples of anchor work in other settings and sectors, and people often take those and use them to influence internally or to engage internally. So, yeah, a bit on best practice here, project management, case studies. I'm just going to give you, yeah, best practice, best practice. So it really is the kind of understanding what else is happening elsewhere. What can you learn from others? Influencing. Okay, great. Help unlocking the potential of the land and building pillar. Mapping and evaluation. Great, interesting. Creative ways to deliver the agenda in challenging times. Well, yeah, that is the conversation we're having today. Absolutely. Convening, sharing, networking, peer support, fab. Brilliant. Really interesting. Maintaining and creating opportunities to increase the anchor profile, evaluation side of things, and how do we influence and empower our communities to play a leadership role in this too. Brilliant. Okay. Ollie, I'm going to suggest we keep that open so people can keep adding to it, but that we stop sharing, screen sharing. And I'm just going to, for 2 minutes, say a little bit about the journey we've been on as HALN and some of the changes we've seen along the way. And then I'm going to hand over to you, Michael. So when we first started the Health Anchors Learning Network, it was funded by the Health Foundation and NHS England, and nothing existed in the UK. The US had a Health Anchors network, but it was the first time we had tried to convene and bring together people working in anchor organisations across the UK, and to think really explicitly about how anchors could use their economic power to tackle health inequalities, really thinking about them as agents for economic change and was very explicitly focused on health inequalities early on. And it just so happened that it coincided with the first year of the pandemic, where there was this sharp laser-like focus on health inequalities from COVID. And one of my biggest reflections is over the last 5 years, the membership of the network and who comes to events like this has changed a huge amount. So when we first started working on the network and running learning sets and events, we had a huge number of people who came more from the procurement side of things, I would say, and also quite a lot from strategy and policy. And people in those roles were very interested in, how do we get an anchor strategy? How do we develop? At the time, there was quite a lot of focus on developing anchor charters or anchor frameworks. We also had some people from workforce. That's always been, that's one of the key anchor pillars, and that's always been quite well represented in the network. But over time, that has changed quite a bit. And now, in the last year to 18 months, I'd say we have a lot more people who have partnerships in their title or who are explicitly focused around convening place-based partnerships to work as anchors together. And that was really reflected, I think, as well in some of what we saw in that Mentimeter in terms of which roles you're coming from, which perspectives you're bringing. We've also always had really strong representation from public health, and to some extent, quite a lot of representation from integrated care systems. Those two areas are probably two of the strongest, with to a lesser extent involvement from other NHS organisations. And we've also seen a lot of demand for people to have more learning opportunities around the place-based structures that they're convening and leading anchor work through. So for the last year, Ollie has been running a learning set specifically for people who convene anchor networks, and we are going to be running another one of those from the summer onwards. One of the reflections I have is we have often not had much engagement from people who work in estates or a little bit more, but not as much as the other areas around net zero. So those two big pillars of anchor work feel slightly underrepresented so far in our journey. And I know that some of you here today may represent kind of roles or functions related to those two, but it tends to be fewer people who come to our events from those. So just a kind of reflection on who tends to engage with this agenda so far. The other kind of big change I think we've seen is the maturity of thinking and practice on this agenda. So when we first started working on anchors, there were there weren't many good quality measurement frameworks in place. And then, maybe 3 years ago, UCL Partners did a huge piece of work developing the anchor measurement toolkit, which is still really widely used. From the beginning, actually, one of the biggest resources people referred to, which is still used very widely, was the Leeds JRF self-assessment framework. And I know Les and Nikki, who worked on that, I think are on the call. And that continues to be a really helpful resource. We can share a couple of links to these in the chat. But it certainly feels that the measurement piece has evolved quite a bit. And when we convene people in our learning sets and events now, they are often sharing with us quite sophisticated impact measurement reports or kind of theories of change that they're using to influence their board and their senior teams. So it feels like the kind of impact storytelling data piece has really matured and come on quite a way. And the policy, one of the big changes has been the policy landscape in which people are operating. And many of you are in the midst, well, we're all in the midst of another big change at both policy level and structural level. And there's quite a lot of uncertainty. And I suppose my reflection is that there have often been moments such as this over the last 5 years. And we have often seen kind of champions and leaders in the Health Anchors Learning Network using those moments of uncertainty to position the work they're doing as part of the way forward or part of the solution. So one of the biggest things we see when we run our learning sets, we ask a question about what role do you feel you're playing as an anchor organization in your local system? And the biggest word people often say is, I'm the storyteller or I'm the champion. They are really kind of, trying to take forward this agenda, often one of the only people doing that. So often they're kind of, the lone people really pushing it forward. And it's great to see so many of you here. And I know many of you have been involved with HALN since the beginning, and we may hopefully get to hear from you a little bit later as we go into breakouts and come back from them. But I'm going to hand over to Michael now because those were some reflections on HALN and how it's evolved. But Michael, we wanted to invite you in to share a little bit about, like, if we take a step back and think about what's happening in the wider policy landscape and what does this mean for people on this call. Very curious to hear your reflections on that. And then we're going to digest in some smaller groups.
Yeah, thanks, Julian. Thanks for the invite. And always good to drop in on your HALN events. And congrats, Ollie, Julian, the wider team. 5 or 6 years. It's incredible. And you always bring together a broad audience. And it was interesting today talking about looking back, looking forward. Yesterday, I was in City Hall in London for a 5-year anniversary of the London Anchor Institutions Network, which I helped set up with NHS colleagues and colleagues from the GLA and other partners there. And it was the sun shone, that makes a difference. It was a really positive event, I think, and I think it was understanding the difference in the context, looking forward and back. And so it feels a good time to be talking about these issues, particularly as we go through all the transition we've got at the moment. This is what we're talking about today, all the examples we've already heard, I think really do. That's what gives us energy, I think. And I'm sure it's not just me, Julie, that gets energy from hearing that and being involved in these conversations. I'm just going to share a small number of slides. I hope you can see that. Give me There you go. Perfect. Yep. Thumbs up from Julia. Wonderful. And I've just put a few slides together, just sort of bringing together some of those crumbs of the national policy context, which Julia mentioned. There's a few of the slides are from an English context. One of the beauties of HALN events is we have colleagues from all over the UK, and the principles, as we know, absolutely cross borders. And it'd be great to hear about what's happening elsewhere in the UK. I was in Cardiff and Belfast just before Christmas talking to colleagues there about this agenda. But for me, if I just flick through, I just want to take us back, what, maybe 3.5 years there was that the integrated care systems in England suddenly had that fourth purpose of helping the NHS support broader economic and social development. And it felt like a bit of a marker, a bit of a landmark. It was the first time we had a real policy responsibility at a system level to undertake this work, and it was a step on and a boost of the anchor work. And we'll talk about where this, I mean, I firmly believe this purpose still exists, and we'll explain where and how and etc. But sometimes, we speak about the intangibles that came up in some of the questions people answered. When I talk about this and I talk to leaders about why it matters, I want to bring the voice of non-NHS colleagues with us. And for me, all these quotes here, more than just a listing of the purpose and what's written in black and white in any NHS strategy, that brings to life what this does and what all our work has done. It's brought the NHS out of its shell. It's made it more curious. I love the word curiosity. Julie, you referenced our curiosity. We're not known for our curiosity in the NHS. I think I'm being honest in saying, so I think there's something like that. We used it to deliver on a range of non-traditional areas, move funding around. The voice and influence of the NHS was huge. Many partners want our advocacy. And I think the anchor role helped us understand that. It helped us understand our knock-on effect in other sectors. It helped create the environment for action, and I actually think the environment for lots of the policies we're now seeing, and it gave us permission. I think it's quite true. If you're outside the NHS, you often think, why is the NHS not doing something? And often it's because we feel like we need permission. And I think the stating that purpose there gave us that permission if we needed it. But permission now is really interesting because I think there's something that's certainly come from the health sector, some of that legitimacy. And I know at any period of change, there are people who are skeptical. Some people might want to retreat us and bring us back to the core, and it might be a very healthcare, not health focus that some of you feel you're in danger of being pulled into. And I just wanted to look at where we might get some of that legitimacy from. And this is a 10-year health plan for England. I'm sure everyone on the call has read all X hundred pages. I certainly haven't. We are recording this, aren't we? I've read everything. I know everything. But what I just want to say, there are parts we can relate to parts of this if we need to feel some of that legitimacy in terms of giving us, in terms of our conversations with our executives, with our partners, in terms of putting strategy together. It speaks about the NHS employment, which came through loud and clear as being a force for economic prosperity and social mobility. It talks about the role of mayors. I'll mention that, and about growth and prosperity. It talks about reintegrating healthcare into the social fabric of places. It talks about civil society, business, what we do. It talks about making research innovation business as usual, not a nice to do. So we can feel confident that I think, that we have that legitimate sense to go into the conversations that come and say, actually, we're talking about both the what and the how. And I've only got a few slides. I'm going through them quickly because I want to hear from you and get into the breakouts. But there's something about reminding us that what we are doing, and the NHS being one of those economic and social actors, one of those anchors, will always be at the heart of policy. This slide we all know this, the difference between being passive and active and being intentional. But if I was to overlay this slide with the key policy drivers that, first of all, we in the NHS are being told, and then also wider government drivers, I just can't believe that everything we learned, everything we're doing, everything we're working on isn't relevant. I mean, again, we'll go back. I mean, everything of being an active economic impact is a core part of neighbourhood health. You can come up with your contracts and you can come up with your technical guidance. I struggle to see how neighbourhood health and, in fact, prosperous neighbourhoods can be successful from an NHS point of view if we're not playing a part in being that active participant and being an anchor. We hear lots about integrated health organisations and advanced foundation trusts and what the hospital of the future will look like. Well, in European systems where capitation. I sound a bit policy wonkery there, but models where the trust takes on more responsibility for given populations. It's the civic role of that hospital and understanding what happens outside it and investing in prevention and what happens outside it that makes it successful. So I firmly believe that what we're doing is relevant for that. And the strategic commissioning framework came out a good few months ago. And what does it say in the very first introductory paragraph? The fourth purpose is absolutely vital. Commissioning is not just the NHS pound and NHS activity. Strategic commissioning is really how we're making our people healthy and using all of our levers, many of which we know lie well outside the NHS. So all of those three dominant current health policies have at the very heart the NHS anchor civic work. We should be confident about that. At the bottom, I've just mentioned some other areas. Economic inactivity, people have mentioned that, which is fantastic. That's a really important public policy issue. Public service reform, I think there's, how we unite services and integrate around communities is going to be vital. We should be at the heart of that. That civic thinking is SEN, the wider economic growth. All of those policies we're at the heart of, but also what's interesting, this work is at the heart of our emerging governance for England. Now, wherever you are in England, and those colleagues from outside have experienced devolution from other parts, you will be going on this journey somewhere of understanding what unitarisation looks and feels like. Are we going to have a mayor? What will those mayoral priorities be? What does a statutory health duty for mayors look like? What does neighbourhood governance look like? We're on this journey of moving to a slightly different, more standardised governance model. And I just firmly believe at the heart of that is an element, if not quite coterminosity, then common public service reform and working together. And I think there's a range of different funding sources and policies coming out, which, Julia, we could spend hours talking about. What I would say is be confident the work you've done in the past 5 years will set us up not just for the future policy landscape, but for the future governance landscape in which we try and embed these policies. And I'm a long-term believer in thinking actually taking an anchor approach is about curiosity, and it means understanding the context in which we operate, and it means asking questions. So I was on the train into London yesterday, going to the celebration event, just thinking, well, what are the questions I might want to ask now and in future, which differ from the questions I was asking myself 5 years ago. And I think, I've put something there about young people becoming a lost generation, particularly worried about NEETs and about economic inactivity. I think a difference now from 5 years is business and place have really created that link. I think part of that is because of the labour market difficulties. But what is the role of business? I think there's a recognition now that for a place to be investable, it needs to be preventative, and that health and regeneration links come through. I think the social contract comes back. So I think and I'm interested in the breakout on people's questions. If we know the policy context and the governance context, how do we bring through our curiosity and drive some of that? And what was interesting in the context yesterday in London, of course, was geopolitical instability. And London's a global city, and London's strategies will have to understand the instability. And that means local borough work will maybe have to think about security and how safe people feel. And it's just really interesting how we think about these fluctuations. And London is approaching, what I haven't put on this is the missions, because we haven't heard much nationally about missions. London is using this framework to rethink some missions focus. But my last bit, Julie, really is the continuation of what you were talking about, which is it is really important as we go through all the change at the different structural tiers and we think about our own work and what we want to do, that we take stock on what we've done personally, professionally. We try and think about some of the joy that doing this, and the learning about each other that we've all experienced. But it's all of our jobs, isn't it, Julie? All of our jobs, national, local, regional, to think about how we build on what we've done, how we don't lose it, how we embed it into the plans that others are making, how we make it part of what we want to do, make it part of both the what and the how. And I'll stop sharing now, Julie, and look forward to the breakouts of what people want to say.
Yeah, I really like that framing of the what and the how. And we are in a moment going to go into breakouts. And that was really interesting, Michael. I think there is this sense that what has been helping us so far continues to help us. The fourth pillar, as you say, the fourth purpose is still absolutely central. And of course, that's very much true in England. And there's colleagues from Scotland who've shared some really interesting links in the chat on the anchor strategic plans that many of the health boards have been developing, which are fascinating and for me are really, an even more mature evolution of what an anchor strategy can look like at a place-based level. I don't know if we have colleagues from Wales and Northern Ireland on the call, but I'd be curious if there are to hear about how anchor work is kind of being shaped in those two nations. But yeah, we're gonna have a bit of a conversation now in smaller groups. So the plan is to give you probably till 1:50, so just shy of 15 minutes, to have a conversation in really groups of 6 to 8, I would say, Amelia, if that's okay. Just a chance to say hello and to share a few reflections on your anchor work. People often make great connections in these conversations. It's totally okay if you would rather stay out of them. That's absolutely fine. But we know that for many of you, it's nice not to just be talked at for the whole session and to have a chance to meet a couple of other people, interesting people from all over the country. So we're going to give you 13 minutes till 1:50, and then we'll come back and just hear a few reflections from those of you in the room before we wrap up. Um, the rooms are open, so you should be invited into them now. Welcome back. Hello, everybody. Welcome back. I hope that that was a nice chance to meet a few new people and share some experiences and reflections from all different parts of the UK. I wanted to just reshare something which Michael has shared. It's an upcoming event in later in Feb on addressing economic inactivity with NHS Confed. If you're interested in that, the link is in the chat. You are welcome to go. It looks like it will be a really interesting space. And we've got a couple of minutes now, 5 or 6 minutes, just to hear your reflections from that conversation. So you can either head on over to the chat and share a reflection or an insight or a resource or just something else that landed for you in that breakout, or give us a wave or come off mute and tell us. It would also be lovely to hear some voices, some reflections, and how you found it. So, whichever works for you, it sometimes takes a few seconds for people to think about whether or not they want to come off mute or to write. So, I'm just going to give you a moment to have a think. What really landed for you in that conversation? What are you taking away? And you can either add that into the chat or give us a wave and come off mute. And if you don't know where the electronic hands up is, you can just wave at me and I'll bring you in. You can see. Les, come on in. Nice to see you.
And you, Julia. Well, my point's actually one that was raised by other people in our breakout group, not myself. And I thought it was a really interesting idea about focus on young people, given massive challenges around workforce and young people being an increasingly large proportion of those who are out of work or economically inactive. So I felt like it was a real opportunity there, and particularly in the way that Anchors joins up big employers like health organisations with the education sector and impending government policy in this area around worklessness and routes back into work. So it just felt like a really interesting area to explore. And as I say, it was colleagues in the group who suggested it, so I'm taking no credit.
Oh, thank you, Les. That's interesting. And I know, we've got so many people here who are focusing on employment, employability, access to work. I was just about to say, Sean, who's added into the chat, that you're prioritizing the challenge of NEET young people as a region. And I'm curious how many other people are doing the same, whether young people is a focus. I can see nodding from Rachel, nodding from a few others. Yeah, interesting. Thank you, Les, and any other reflections or points from the breakouts that you'd like to share back? Big focus for the West Midlands as well, working with young people out of employment. Interesting. And a few people adding into the chat. Sonal, a reflection, great to focus on how we define and celebrate collective impact. Yes. Yes, how you do that as a partnership can be such a challenge. And Claire, adding this in for Sandra, our NENC Learning Academy, free training. Brilliant. There's a link there to the Learning Academy and some anti-racism learning, which is available to everyone. Brilliant. Thank you, Claire. Fab. Any other reflections? We keep adding. I mean, some of you are typing at the speed of lightning to get it into the chat, which I'm very impressed about. But if you do want to come in and share anything else, you are really welcome to. It's always nice to hear some voices other than ours. Um, Otherwise, Michael, I wonder if there's any final reflections you have. We were doing a little bit of chatting while you were in your breakout rooms.
Mm. Thanks, Julian. Thanks, everyone. Les, completely agree about young people. And I think how we have the option on anchors to take an issue and a theme rather than just, our normal way of quite siloed and sort of structural ways of working. And if we can pick a theme where we think there absolutely will be government focus, government policy, there'll be money, and yet it really relies on local partnership building. I think that's a way we can have confidence what we can do can have impact and can have political impact as well, actually. And I think that's why young people, for me, it is the biggest political, social, economic challenge of our time. And I think actually we've got an inherent responsibility to act in that space. And nothing through a typical NHS policy lens is quite going to bring us into where we need to be. So I think that's where this issue, seeing it almost the wrong almost coming at an issue, Julie, from asking a question rather than a classic NHS top-down policy. I think it suits it, and so I think there is, and one of our jobs might actually be, as we're doing an economic space, is to join some of the dots upon this and just to work out what good local practice looks like in needs, because it is a challenge everywhere. And so that's really interesting. And we've heard lots across borders too. I'm always a big advocate, Julie, of just understanding what's happening across borders. We can be so in England, everything's so complicated. We go, we're going to have internal debates here, whereas actually there's some fantastic place-based work happening outside of England, and so that's something we need to bring. But I think it shows you that the next stage of HALN is going to be busy, and it's going to be taking this agenda forward. And I think we all have a responsibility to try and make sure what we do now fits with the future, and make sure that future is one we all want as well.
Mm. And I think there's a lovely contribution. Well, there's many coming through now in the chat, but one from Joanna, which really resonated, which is, we should remember that the kind of unemployed young people conversation isn't just or shouldn't just be an employment and skills conversation. It can and should be also social value, procurement, net zero conversation. I think that for me is the power of thinking through an anchor lens, which is what is this, what are all of our economic levers that we have at our disposal? How does what we're buying day to day affect employment opportunities for young people? And the other thing that I think that links to for me, and there's so many of you on the call who are working across anchor partnerships, anchor networks, the kind of convening and place-based infrastructure that enables collaboration, is that when you work in a place together, you share a population. So, it makes so much more sense to think about some of these big thematic challenges that you're grappling with locally together rather than separately, because you can do so much more together. And some of you are reflecting on how challenging some of the jobs portals and NHS, job application processes can be, and having to find ways to try and bypass it. And I wonder if sometimes those are some of the biggest challenges we find, is not the lack of ideas, but the kind of systems and processes that you somehow need to get out of the way. Anyway, there's some fantastic contributions in the chat, and lots of people sharing their details to carry on the conversation, which is really lovely to see. We're going to just wrap up by sharing two things. One is a link to an annual survey we're running. We're currently designing the support through HALN for the next year. And so it's really helpful. We've had that in the Mentimeter, and also to have your reflections on what you would find most valuable and helpful. And we'll be sharing some resources after today, but there's a couple of recent resources which you might find helpful. There's a new blog on the power of good communications. We so often in our learning sets that we run hear people talking about themselves having to kind of tell the story of anchor work, having to explain what it is, and having a really crucial kind of communications role. So that might be interesting if you feel like that's something you find yourself doing all the time. And lots of you said you wanted case studies. We have got tons of them. Here's one of the most recent ones, which is supporting healthier, greener travel in Wales. So two kind of slightly different angles to think about your anchor work from the majority of the conversation we've had today. I just want to say a huge thank you to everybody who came. It's 2 o'clock now, so we're going to let you go, but the recording is available online, and there are tons of other recordings. So do dive in. If you're still at the start of your anchor journey, there's an awful lot out there that could help you along the way.